I'm presenting my research project on assessing patient-reported outcomes in caregivers of children with attention deficit hyperactivity disorder to identify opportunities to optimize treatment adherence. Attention deficit hyperactivity disorder, or ADHD, is a relatively common chronic childhood condition affecting about 11% of the children in the United States today. It has a well-established evidence-based treatment guideline for using medications, yet adherence to these medications has been problematic. Within the U.S. healthcare system, there's also been a paradigm shift toward more patient-centered care, which takes into consideration the patient's preferences for treatment decision-making. So we expect that preferences for treatment outcomes can influence adherence, yet few studies have shown whether patient-desired outcome priorities can be used to assess clinical progress with medication treatment. As a result of the paradigm shift, patient-reported outcomes, or PROs, were created to involve patients in their own medication treatment plans. PROs are intended to capture the patient's self-report of symptoms, functioning, attitude, and quality of life, or rather how a patient feels toward their own health or health management. For social populations, such as in children with ADHD, their caregivers are the ones who provide the treatment decision. So in this study, I will utilize caregiver-desired outcomes as a proxy report to see whether there is a gap between caregivers' priorities for treatment outcomes and the outcomes routinely monitored in standard clinical practice. This would then help to identify opportunities for pharmacists to optimize patient-centered outcome priorities for children with ADHD. I used a prospective study design that followed the subject over a 6-month period. The study utilized caregivers of children between the ages of 4 and 14 who are currently receiving care for their ADHD diagnosis. Caregivers were recruited through many facets in over 10 counties within the state of Maryland. The results focus on 50 participants who had completed the baseline and 6-month follow-up. Computerized surveys were self-administered by the caregivers in person at baseline and then again at 6 months. Data was collected on the child's current ADHD treatment and the caregiver's desired changes. The caregiver-desired outcomes in their child's ADHD symptoms were collected in a free text format. These free text outcomes were then classified into major domains and compared to domains of a validated PRO instrument that is used in practice to monitor clinical progress. Descriptive statistics were used to examine the distribution of caregiver-reported outcomes. Of the caregivers, most of them were the mother of the child in the study. A majority of them had a high level of education with a college degree, while a good proportion of our caregivers also had up to a high school education. The mean age of the children was about 10 years old, with a mean ADHD diagnosis of 4 years. In our surveys, we first asked caregivers to indicate their child's current ADHD treatment. If you direct your view to Figure 1, the chart shows that although these children had been diagnosed with ADHD 4 years prior, still less than 80% of them were on a medication for their ADHD. This is comparable to national statistics, where about 20% of children diagnosed with the disorder does not use any pharmacologic agents for treatment. For the children who are using medications, we asked our caregivers to report whether they had seen any changes in their child's ADHD symptoms, which could be attributed to medication use. In Figure 2, you can see that close to 90% of caregivers saw improvements in their child's ADHD symptoms after utilizing medications. Yet when we asked what additional outcomes they would like to see in their child's ADHD, almost 3 out of 4 caregivers still hoped for more improvement. This shows that symptom improvement alone is not a strong correlation for treatment satisfaction. Only about 1 out of every 4 caregivers expected no additional changes, while more than a third wanted even more symptom improvement. As expected, caregivers hoped for changes in academic performance, optimized treatment regimens, and social functioning. What's surprising was the emergence of a new set of domains, grouped as self-regulation of the child. These outcomes included the child taking responsibility for their own behaviors, being aware of the consequences of their own actions, learning independence, and also self-confidence. In Figure 4, when these caregiver-reported outcome domains were compared to domains in existing PRO instruments, you can see that there are important areas of interest to caregivers that are not being assessed in current measures. These include the self-regulation features in the previous figure. These results show that when medications are being used, they are indeed effective in treating ADHD symptoms. Yet there are additional outcomes desired by caregivers. And as clinical practice changes toward providing more patient-centered care, it becomes essential for caregivers as a voice for their child to develop treatment plans with providers that will enhance the outcomes they desire most. By aligning the caregiver's goals to that of the child's treatment plan, this will hopefully incentivize medication adherence and overall treatment optimization. Enhancing current PRO instruments to capture these additional caregiver-desired outcomes may lead to more patient-centered care and better monitoring for treatment progress. And pharmacists are poised as a medication specialist to play a pivotal role in improving the medication adherence and treatment optimization of their child with ADHD.